I'm going to assess the respiratory system. Posture is upright, and I'm not noticing any distress with your breathing, no nasal flaring, and your breathing seems to be normal, within the normal limit. So you know, it's very nice, and you are breathing fine. Your skin is warm, and you know, I can check here, it's normal rate, and here as well in your brachial. So it looks like it's normal rate. I want to palpate the back and let me know if you have any tenderness. Okay, I'm not feeling any tumor. It doesn't feel like there's any problem or any protruders. I'm going to palpate the thoracic expansion using my tongue, and it's a T10. I need you to hug yourself and take a deep breath for me, in and out, and let it out. Okay, so it looks like it's equal in movement. I'm going to do the full Firmness test, and I'm gonna use the palm of my hand. Every time you feel it, you're gonna say 99, okay?
99, 99, 99, 99, 99.
Tactical Firmness decrease. It looks like it decrease as I go from the apex to the lungs, to the bottom and the base of the lung. Using precaution. I need you to take a big hug. I have a big hug. Take a big hug. I'm gonna percuss for your lungs, okay? So everything looks, it's resident throughout the lungs. I'm going to do the diaphragmatic excursion. Now this exam is to see how much air going in and out, and you're gonna take a deep breath in, and as you exhale to hold on to the exhalation. Okay, so I'm gonna put a piece of tape here, and that is the beginning of your full inhalation. Take a deep breath and hold it in. Okay, you can let it out. I'm going to post a second piece of tape, and this is your beginning of your full exhalation. It's between 4 centimeters within normal limit. I'm going to listen to your lungs posteriorly. Usually I would have to do anteriorly and laterally. For the purpose of the video, I'm just gonna listen posteriorly. Deep breath for me, in and out through your mouth. You had great lung sound, and everything seemed to be intact and normal limit. This is the cardiovascular system, but first I want to go over some part of the suprasternal notch, and this is the clavicle, the first rib that is hiding under the clavicle. And then this is the second intercostal space next to the sternum, and right across there it's the aorta to the left border of the sternum. And the third intercostal space is right underneath that, and it's called the earth point. Okay, and we can look at it to the left side of the body. That's your earth point. And also further down is the fourth intercostal space, and that's the tracheal space. And if you divide the clavicle in half, you find the fifth intercostal space. Okay, I'm so sorry. And it's called the mitral apical area of the heart. I'm going to check if I notice any palpation. I'm going to do that in the fifth intercostal space, in which where the aortic palpation is, and that's where your left ventricle is. I don't notice any limping or heating of the heart. Check your jugular vein to see if not the carotid vein, there's any distension of the vein. People that have like increase of the jugular vein pressure, you will see that there is wave or edema of the vein. And I don't see any distension of the vein. I'm going to palpate the different part of your heart: aortic, pulmonic, the herbs, the tricuspid, and the mitral apical, which is the fifth intercostal space, and this is where I would be able to hear the apical pulse. The fifth intercostal space, and this is where I would be able to hear the apical pulse, and it should be about 2.5 centimeter. If it is lower than the heart, I would consider that your heart to be enlarged. To palpate the different part of the heart, because usually if there's a problem with vibration, it would be that you have some kind of murmur. I'm gonna use the palm of my hands. So it's the aortic and the pulmonic, the herb, the tricuspid, and the fifth part, which is the apical. I didn't notice any murmur or any other type of problem. I'm going to listen to the different part of your heart with the aortic, pulmonic, herbs, tricuspid, and then the mitral apical. What I've noticed is the aortic is S2 is louder than where the apical is, which is S1, or any low pitch, which will tell us about murmur, like for S3 and S4. Listening to the lobe, S2, and then here I'm also hearing the dub lobe. Here as well, I can hear the dub lobe and the tricuspid. I'm hearing the S2, the lobe, and then the apical. I can also hear the lobe. Able to hear any S3 and S4, so which means there is no sign of murmur in your heart. On the side, to assess your heart, and I'm gonna use both sides of my stethoscope, and I'm gonna listen for the aortic as well, and basically I'm looking for any sign of murmurs, and also I'm gonna test for the carotid to see if there's any sign of murmurs, and as well as the apical. Okay, notice any sign of murmur, no S3 and no S4. Forward for me, I'm going to look for any murmurs in the aortic and the pulmonary. Okay, so and then pulmonary, I don't hear any murmurs in the aortic and the pulmonary. For your peripheral pulse, okay, and I'm going to palpate them. Start with the temporal pulse, and that's a +2. The carotid pulse, that's a +2, and the brachial pulse, That's a +2. The radial pulse, that's a +2. And the radial pulse here, that's a +2. Peripheral pulse in your legs. To start with the popliteal pulse, and that's a +2. The dorsal vertical pulse, that's a +2. And the anterior pulse, that's a +2. And then the posterior tibial pulse, and that's a +2.